Hey everyone, happy Thursday. Today we're going to dive into the world of radiology to see how our team is keeping everyone safe and also helping with the diagnoses of COVID-19. But first we're going to kick it to Lee for the stats today.
Today was a very good day. We had 0 positive tests today, so hopefully tomorrow will be the same. A lot going on, talking to my peers at other hospitals in the region. Some of them are seeing little spikes, and so we've got to be careful. We've got to stay vigilant. Talked to several community leaders today. A lot of things people are getting back to work. I think the casinos are opening, some of them now. We've got to be careful. Be aware of your surroundings. If someone's coughing, get away from them and ask them to wear a mask or isolate. Don't touch your face. Wash your hands. Remember all those things we've been talking about, because we could easily have a resurgence. But anyway, today, very excited to talk about the world of radiology. And first, I have a question for Jared Fetters, who manages things over here on this side of the county in radiology. And if you would, Jared, just tell us a little bit about things you guys have done to make sure that during this pandemic, it's safe for patients to come in.
Certainly. I mean, we have kept everything the same that we had beforehand. We're taking care of our patients with the utmost respect, utmost cleanliness. We're making sure our equipment is clean. We're wearing PPE that we have appropriate amount of. We're making sure that we're taking care of you while we're taking care of ourselves. We don't stop. We're here 24/7, certain modalities in the hospital. So we're taking care of the patients as they come in, inpatients, like we said earlier, outpatients, anything that we need to do.
Y'all got it. So safe as it ever was with our great in-house CVS team.
Yes.
You guys work hand in hand
Yes, we
with
do.
them.
They work
Teamwork.
great with us. We clean the equipment. They come behind us, clean it secondly, so we're hitting it
Strong
both
and
hands.
clean. That's awesome. Well, quickly, I want to ask Lance a question. Lance is our director of radiology for the whole system. And tell us a little bit about the technology that we have, some of the cool things. I know y'all have like the 4 billion slice 52 zip dot whiz machine. Tell us a little bit about some of those things.
Absolutely. I consider myself an early adopter of technology, so I went and twisted Lee's arm into letting us install the latest CT scanner that we have. It's called the GE Revolution. It's a 512 slice, 160 millimeter detector CT scanner.
512 slice. So I remember when I first started here, which wasn't very long ago, the technology out there were like 16 slice and 32 slice things. So that is just a huge increase in the granularity of the detail of what you can see.
Absolutely, and the detector is about 7 inches wide, and that allows us to get 512 slices out of that 7 inches. That is a lot.
Wow.
So we can see things that are as small as a grain of sand.
That's amazing.
Yeah.
So what other technology do we have? Tell us a little bit about, or you or Jared, either one, about, we've got the latest in MRI, CT, you name it, right?
We have a wide bore MRI that was installed recently.
So what the wide bore means is, I've had a lot of MRIs in my life, unfortunately, and you go through that little tube, and even if you're not claustrophobic, it's a little weird, and I know people have had challenges with that, but here, with our MRIs, it's a comfortable thing. We don't feel quite as claustrophobic, right?
Correct, and we try and do everything we can for the patient. The wide bore is the technology that we decided to adopt just to help out with that.
And you've got those, Jared, I guess. Which of our locations has the MRI?
We have them at all 4 of our locations.
Okay, so the hospital, the medical park.
Hospitals, both medical parks, here in Ocean Springs and in Pascagoula as well. Another thing that we help with the patient ease is we have music available for them as well.
Oh, cool. Whatever you want.
Whatever
Country,
you want.
rock and roll,
Whatever you
rap,
want.
you name it.
Yes, sir.
All right. And last question for you guys before we turn it over to Sarah and Dr. Carter. What about if somebody needs to get in? Say I'm in a doctor in wherever, Harrison County, Mobile, Georgia, no matter where I am, to be able to come get your technology, what do I do? Tell the doctor just, hey, I want to go there, and can you get them in quickly? Or
Yeah, we can normally get our patients in same day, at most, next day. We work hand in hand with our scheduling department that's really great at contacting us if there's any issues. But typically between the 4 main imaging areas in our outlying clinics that we have, imaging services that we can get you in same day, next day.
That's awesome. Great radiology team. And speaking of which, led by Sarah, you want to introduce our other special guest?
Yes, so right now we are with Dr. James Carter. He's a radiologist, one of 6 that we have here at the health system. So whether it's a preventative screening, you break your arm and you go to the ER and get an x-ray, These gentlemen are the ones behind the screens that are reading it and telling your providers exactly what's going on. So tell us a little bit about how has radiology kind of stepped up during the COVID pandemic?
All right, thank you, Sarah. Well, what we're here to do, we have 6 radiologists, as you said, 4 on duty at all times. So we're here all day, every day, looking at x-rays from a list coming from the emergency room, from outpatients, from everywhere, onto our computer screens. So we're in this office looking at big screens here, very high-tech screens here, and we're looking for, like you said, diseases. We're looking for, in this case, COVID-19. Our emergency room doctors or our outpatient, internal medicine nurse practitioners, if they have a patient who has shortness of breath, has fever, they think they might have COVID, the first step will be to get a chest x-ray. Most of the times that's going to show something going on that's abnormal if the patient has that disease. Peripheral bronchoascopathies, for instance, could have that. That's very common.
So the severity of the disease process. Because we get the lab test done, they can tell you whether you have it or not, but how severe, how mild?
Right, the chest x-ray can help a lot with that, but for other cases where you need to problem solve, we have CT scanners for that. Let's say the patient has short hypoxia, which is shortness of breath, that's getting worse, and the inflammatory markers like C-reactive protein, for instance, that's going way up, or the white blood cell counts are low. They may want to get a CT scan of the chest. We have an example right here, for example. 9 months ago, this particular patient had nice, clean, dark-looking lungs, as you can see right here. Just beautiful, normal.
Full air.
Later on, the patient came in with the symptoms, and we got a new chest CT, and here you can see that there are a lot of findings that showing lung damage associated with the virus. We've got peripheral bronchoascopathies, both sides, so multifocal, bilateral, mostly peripheral. Bronchoascopathies, you can see here on this close-up, it's just areas of whiteness, increased density compared to normal lung adjacent to it. More confluent consolidations, more peripherally. This indicates that the lung has been damaged. The alveoli, where the air sacs normally are in these dark areas, become filled with inflammatory debris and fluid caused by the cytokine storm you may have heard in the media or read about, that causes these areas to fill up with fluid. This particular case is maybe moderate. It definitely can get worse than this. With time, as the patient improves, you'd expect also the x-rays to improve, the CT scan to improve also. So maybe a month later, this patient would look close to normal or getting close to normal. And this particular patient did well, I understand.
Mm-hmm. So what do you do next after you've made the findings?
Well, you do your report, of course, you dictate it, we have voice recognition, and hopefully you get your voice, all your words correct, not always.
Yeah.
Send it out, and if you suspect COVID-19, you want to get that out fast. Instead, you maybe want to make a phone call to the physician to make sure. So anyone who's come in contact with that person can then start tracing and making sure everything's good.
That sounds great. And so, what else do you guys provide here as far as procedures go as a team?
Well, everything. We're a full-service radiology department. We do everything. There's nothing we don't do. We're a very high-end radiology department. MRI, ultrasound, nuclear medicine. Just everything you can do. We do prostate MRI. We do breast MRI. We have high-end intervention radiologists. In fact, that opens me up to something else. We have a brand new intervention radiologist joining us next month, right. Dr. Pat Patton. So we'll be offering high-end intervention radiology at both of our hospitals now, moving forward. So Singing River Hospital will have him. We have Marshall Walker here. They do high-end procedures such as spine procedures. The patient has an osteoporotic compression fracture, lots of pain involved there. They can go in and do kyphoplasty, just about immediate pain relief with that.
Right, so back pain, if you have trouble standing up all the way straight, our radiologist can definitely help you.
Can definitely help. Also, like pulmonary embolism, COVID-19 is also associated with increased coagulation, and so you can have lots of thrombus forming, particularly in lungs. That does happen commonly. These radiologists can go in and thrombolyze or melt the clots in the lungs to free it open it up again.
So that's really cool. You can find the clots, and then you can go in and take care of them and make sure that people are able to
Yes, thank goodness we can.
breathe and not lose consciousness for sure.
So you guys don't just do, it's so critical to have people that are good at reading these images and all the knowledge you have to be able to help diagnose. But you guys also do so many procedures, and then with the interventional radiologist, those higher level procedures on top of that. What's it like working with such a great team that you have?
Well, I tell my family, I tell my partners, we've got the greatest job that there is to have. It's a great job.
Yeah.
You get to come in and diagnose, try to help patients as best you can, and it's a great job.
One of the things I've loved about you guys is that for patients that I know, people that I know in the community, they've been to other health systems where maybe they had an MRI or a mammogram or something, and they didn't feel like they were communicated with quickly. They're left in limbo. And I know you guys pride yourselves on being able to get back with somebody. So, you know, again, I was with a woman one time who had a mammogram, and those minutes between the time that she has it and hearing from the radiologist and actually speaking to the actual doctor, that's an anxious time. And you guys are really good about our times to communicate are some of the best in the nation. So tell us about that.
Well, Lee, thank you for bringing that up. That's actually one of the most rewarding things about this job is when a woman comes in very, very anxious. You feel something in her breast, she's very concerned.
Sure.
She comes in to get a diagnostic mammogram, maybe an ultrasound too. We can go in and talk to her and let her know what's going on. And the most rewarding part is you can find out something as simple as a cyst, or maybe it's a benign fragmenoma, but something that you can calm her down immediately.
Right.
And the look of relief is very rewarding when you can do that and when you can.
And when there's challenges, another thing that I've seen with you guys that I love when they have the tumor boards, the things that they do here where they go over, you guys don't just meet with other radiologists, you get involved with surgeons, with the cancer doctors and everything.
Right.
And it's this whole continuum of care where when somebody's dealing with one of you guys, they know that you're going to collaborate with everybody from pathology to ER, whoever it is, and that's a pretty cool thing. I've witnessed you in those meetings. We appreciate it.
Well, every Wednesday morning at 6:30 in the morning, we get together, like you said, with cardiovascular surgeons, pulmonologists, oncologists. We all get together, we go over cases. We look at it on the big screen, kind of like this, and decide what's the best treatment for this patient. And we do it pretty fast, and then it's all written up in the Epic system, and the plan is formed, and just go about it.
I remember one of those, I don't make it to all those, but I get to rotate through them every now and then. I remember Dr. Satala came to one that you were at when he just started, one of our critical care pulmonologists, and he said, Lee, I'm going to tell you something. I've been to other places in the country, and nobody does it as good as you guys do it. To have all those doctors together at 6:30 in the morning before their day of regular seeing patients starts, I want to be that patient where I don't just have one doctor. I've got a radiologist, pathologist, a surgeon, a cancer doc, and radiation oncologist all together. That's a big deal.
Wow, thank you.
Yes.
And I noticed here our core values, number 3, caring communication. That seems to be one you guys are top in.
Hey, it's key. It truly is.
You guys are the links for the system. Everybody else is coming through y'all. So we appreciate all that comprehensive and continuum of care that y'all, it all starts with y'all.
Well, we pretty much touch everything from in the womb when a baby's first formed all the way through the end of life. We're kind of
Right there.
see it all. Yeah, that's right.
How important is it for people to get screenings?
Very important. Catch it early, you can take care of it. In fact, one of the oncologists, Tika Washington, had told me recently, she's seen so many early cancers, some of them are so small that all they have to do is take it out and there's no treatment involved. They're done.
That's awesome. Get your screen. That's a
Yes,
great
we have
point,
all this
Sarah.
great technology. We can find it fast as long as you show up. That's all it takes.
So if they've got a question about a screening, they can call their primary care physician.
Yep, that's who they need to call, or they can call our 809-2355 number as our scheduler, and they can give you a whole list of the screenings we offer here at the system.
That's awesome.
We're all open for business. We've got all of our 6 radiologists working right now. We have all of our facilities open, so we're ready to go and
Ready to
Anything
see
you
you.
ready.
All right.
Thank you very,
Thanks
very
for being
much.
such a strong team, and we appreciate the strength that you guys bring to the table. So stay like these radiologists, Singing River strong.